thank you that you agreed to have this interview with us, with me, with our team. I have 4 questions to you. The first one is about the topic of this year forum. It's Dancing with Elephants, New Partnerships for Health, Democracy and Business. So could you please pick up one of your choice and tell us one challenge and one opportunity for the health sector to dance with it?
With this one, I'll back it up with some data in a recent survey and a small sample that we've analyzed. We've seen that throughout the initial phases of the pandemic, only about a quarter of 180 people who responded have received direct communication from the medical and healthcare professionals, which is quite low, and we're not blaming everybody. It's been a difficult time with a lot of changes, but I think people really want and need more information. And from our participants, we've seen mostly they have been consuming this information about COVID in the general news or social media, and that is really not targeting this population that might have specific needs. So in terms of health literacy, I really see it as a set of skills, and that knowledge and information plays right in with the ability to find and critically appraise that information for successful application and self-care. So the first step could be helping cancer patients by communicating, because now we have come up with a lot of resources, but a part of me is not sure if those resources are being utilized in the way they were supposed to, and if they were designed with the specific needs in mind.
So the second question, like connected with you already said, it's you're a cancer survivor patient. So putting yourself in the shoes of cancer patient now during the pandemic, during COVID-19, what health literacy measures would you like to see made available to them, to patients?
I will go with mental health. Normally we are in this situation, and like many other big events, life events such as natural disasters, we've seen an increase in mental ill health afterwards, and this time we're really all in it. And I see in my work particularly, I focus on the well-being of cancer patients. So there might be at an increased risk for infection, so particularly vulnerable in terms of physical health as well as mental health. Okay. So yeah, one challenge related to that I see is really the lack of a clear exit strategy. We had a beginning with the lockdown where really things just, the new regulation came into place, but as we move along with the second wave pending, we're not really sure how are we going to deal with the delays, with the backlog of patients, of millions of patients, and all the associated distress that comes with it. On the other hand, on the more optimistic side, I do think that this is a time that is ripe for many opportunities. One of them being, for example, streamlined cancer care. Yep. Whenever and wherever we can, perhaps making chemotherapies available at home at the comfort of one's family. And but that will also bring along other challenges, and I think that's gonna show and highlight the need for improved health literacy, which is what we discussed.
Oh yeah, and the next question is about the next hot topic now, which is Europe's Beating Cancer Plan. So do you think that that this plan could be really efficient, or it will be the next collection of how to say, recommendations, set of recommendations?
I think the plan is very ambitious and has a lot of potential. I see it as another opportunity for us to make a real change, and I hope that we'll take this opportunity and make the most out of it. But in order to achieve that, I believe we need strong collective action with citizens, commissioners, politicians, researchers, and patient advocates all sitting at the same table And more importantly, all of them, everybody involved should do their respective homeworks. We have the resources, we have the knowledge, but each party will bring something different to the table. And I think it's really the time when we should stop perhaps thinking so much in terms of, do we have the right answers? But we should be asking the right questions. I think sometimes for a major change, what we need is really just a small step back.
Staying at the same topic, what do you think about the top action that EU could do to advance health literacy, like, you know, within the Europe's Beating Cancer Plan?
To advance the health literacy, I think personally I would focus on including it as a skill for healthcare professionals to learn how to better communicate the medical information to the patients directly in the limited time that they have with the patients. Yeah, because they really find it, we find that patients mostly trust professionals and their primary doctors. So there could be a way to start there.
No. And at the end, there is something that you want to add, and maybe some message or conclusion?
I think I just want people to show a bit more solidarity. This is a really difficult situation for everybody involved. It's a warning. It's revealed many ugly truths that we have to face.
Yeah.
But I think in doing so, we can all do better, a little bit more, and collectively, in solidarity, move forward.
I think that's a great message of our talk, and, you know, at the end of this year forum Gastein. So thanks for the interview and for your time, and hope to see you again soon.
Thank you, Paweł.
Thanks.
Talk soon.